Mitochondrial disease. Our presenters are Carol True, Kendall Sui, and Maria Viscara. Review of the mitochondria. It is the powerhouse of the cell. They help turn the energy we take from food and convert it into energy that the cell can use, also known as ATP. Different cells have different numbers of mitochondria. The mitochondria have their own set of DNA. During reproduction, half of the child's DNA comes from each parent, but the child always receives their mitochondria DNA from their mother. What does the mitochondria do? We always learn that the mitochondria is the powerhouse of the cell, but only 3% of the genes needed to make a mitochondrion go into its energy production equipment. The vast majority of the remaining cell genes are involved in other jobs that are specific to the cell type where they are found. Other jobs include apoptosis, which is cell death. It decides which cells are destroyed and releases cytochrome C. The mitochondria also stores calcium and produces heat during a process called the proton leak.
So now we're going into what is a mitochondrial disease. So as an overview, mitochondrial diseases occur when there is some sort of mutation in the mitochondrial DNA that makes it so the mitochondria fail in some way to produce enough energy for the body to function properly. Approximately 1 in 5,000 individuals have a genetic mitochondrial disease, but they can also occur randomly through mutation. They are chronic diseases and genetic and often inherited. They can be present at birth, but occur at any age as well. They can also affect almost any part of the body, including cells of the brain, nerves, kidney, heart, liver, eyes, ears, pancreas, and more. So, going a little bit more into the inheritance of mitochondrial diseases, mitochondrial inheritance is different because mitochondria contain their own DNA. Only mitochondrial disorders caused by mutation in the mtDNA are exclusively inherited from mothers. Therefore, if the mother has a mutation, there is a 100% chance the child would inherit the disease. So, going into the signs and symptoms, there are a variety of signs and symptoms of mitochondrial disease because it depends on which cells, organs, and/or organ systems are involved, how severe the symptoms are, and what age they occur at. Due to this complexity and the wide variety of symptoms, the disease is often mistaken for other more common diseases. Some examples of signs and symptoms include poor growth, muscle weakness, muscle pain, and low muscle tone, vision or hearing problems, learning difficulties or delays in development, heart, liver, or kidney disease, diabetes, increased risk of infection, neurological problems, and more. So, for diagnosis and treatment, there is no single lab or diagnostic test that can confirm the diagnosis of a mitochondrial disease. So, any indication of this type of disease should be referred to a specialist. Some of the tests that can be done include a review of the patient's history, specifically genetic history, a complete physical exam, neurological examination, metabolic examination of blood, urine, and if needed, spinal fluid test. There are also MRIs, EKGs, and more. So, unfortunately, there is no cure to mitochondrial diseases, so all treatment is to reduce the symptoms or slow the decline of health. Treatments vary from patient to patient and depends on the specific disease and the severity of their symptoms. So this chart is just a brief overview into the different genetic classifications of human mitochondrial disorders due to mutations in the mitochondrial DNA.
So there are numerous subtypes. However, here we'll go briefly through 4 of the more common subtypes of mitochondrial DNA. The first is Leigh syndrome. a rare genetic neurological disorder that typically presents within the first year of life or early childhood. Genetic mutations in mitochondrial DNA interfere with the energy source that runs cells in the brain that are active in motor movement. Symmetrical lesions or damaged tissue in the brain are seen on MRI of affected individuals, affecting the myelin sheaths of nerves, which in turn reduces the activity of nerves to be able to signal to cells such as muscles. Through advanced imaging and thorough clinical evaluation, MRI, CT may show abnormal parts of the brain. Lab tests may show lactic acidosis and blood sugar levels. Symptoms are very rapid progression of symptoms and are associated with severe neurological degeneration. Earliest signs in infants may be loss of head control and motor skills, poor sucking ability that may be accompanied by generalized weakness, lack of muscle tone, episodes of lactic acidosis that eventually lead to respiratory and kidney function impairment. Treatment, administration of thiamine or vitamin B12, but mostly it's directed towards asymptomatic treatment. On the left shows the autosomal recessive gene from parent to child, and on the right shows examples of symptoms of Leigh syndrome that manifest in children. KSS, or Kearns-Sayre syndrome, is a rare multisystemic neuromuscular and slowly progressive disorder, whereas Leigh syndrome is a rapidly progressive disease with early onset within the first year of life. KSS onset before the age of 20, characterized by progressive limitation of eye movements until there is complete immobility accompanied by eye droop. People with KSS have a single large deletion of mitochondrial DNA, resulting in the loss of genes important for mitochondrial formation and oxidative phosphorylation, which is the process of converting oxygen into a form that can be used by cells. Rarely can mitochondrial DNA deletion manifest as Leigh syndrome. Most cases appear to occur as a result of spontaneous deletion of a large amount of genetic material found in mitochondrial DNA. On the right is a photo of a child that presents with symptoms of KSS. Symptoms are defined by the triad of symptoms onset before the age of 20. Pigmentary retinopathy, or salt and pepper pigmentation in the retina, can affect vision. Progressive external ophthalmoplegia, PEO, which is a disorder characterized by slowly progressive paralysis of the extraocular muscles, and at least one of the following: heart block or disorder in the heart's rhythm, increased cerebrospinal fluid protein, or lack of muscle coordination. Other symptoms may include muscle weakness, short stature, hearing loss, endocrine issues such as diabetes or hypothyroidism, and/or ataxia. Treatment: prophylactic pacemaker for heart problems to prevent complete heart block and asystole, surgery to correct vision problems, and symptomatic treatment and treatment of secondary conditions such as diabetes. MELAS, also known as mitochondrial encephalomyopathy, lactic acidosis, and stroke-like episodes, most common subtype of mitochondrial disorders. The onset is usually in childhood between the ages of 2 and 15, but delayed onset of cases have also been reported. The distinguishing feature in MELAS syndrome is the stroke-like episodes. MELAS syndrome is probably the most common type of mitochondrial myopathy caused by mutations in the mitochondrial DNA. MELAS causes lactic acidosis and recurrent stroke-like episodes in the brain, migraine-type headaches, vomiting, and seizures, and can lead to permanent brain damage. Symptoms. Other common symptoms include PEO, generalized muscle weakness, exercise intolerance, hearing loss, diabetes, and short stature. The accumulation of lactic acid has been noted to accumulate in the spinal fluid and the brain that leads to deterioration of intellectual function. Treatment is also symptomatic management.
Pearson syndrome, sideroblastic anemia with vacuolization and exocrine pancreatic dysfunction. Vacuolization is defined as the formation of vacuoles or vacuole-like structures. An overview of Pearson syndrome. It affects many parts of the body, but especially the bone marrow and the pancreas. It's an infantile disorder. It is also the failure of hematopoietic stem cells of the bone marrow that produces red blood cells, white blood cells, and platelets, causing a child to often feel weak, tired, be more sick, bruise more easily, and taking longer to bleed if they ever got a cut. It is usually caused by deletions of the mitochondrial DNA. In most cases of Pearson syndrome, it occurs by mistake, also known as de novo mutation, during very early development of the embryo. Sadly, many children that have Pearson syndrome die during infancy. Some children may survive into later childhood, but may go on to develop KSS, which is more likely to affect the brain, spinal cord, and nerves. Symptoms include effects to the pancreas, which can cause frequent diarrhea and stomach pain, trouble gaining weight, and diabetes. There is no cure, however, the goal of the treatment is to decrease the seriousness of the symptoms so that the child can live as healthy and as long of a life as possible. Frequent blood transfusions are often needed, as well as pancreatic enzyme replacement or insulin injections. Affected children need to avoid people who are sick with bacterial or viral infections because they are immunocompromised. In other words, they are unable to fight off illness as well as other children can. These are stains of bone marrows from a patient with Pearson syndrome. Pictures A and B show numerous vacuoles that are round cytoplasmic holes. In picture C, it shows increased erythrophagocytosis. These are our references and citations if you wanted to double check them. And that is the end of our presentation. Thank you.